So hello everyone, welcome to Before and Beyond. I'm Dr. Amanda, nice to meet you. Not that I can actually see you, but I'm imagining. And today we'll be going through a case that I saw not too long ago. And basically I will be going through what's going through my mind if I were to see someone like this for the very first time. Okay, so we're going through things that relate to health and as well relates to aesthetics. And if you find that any of this maybe you can relate with some of these issues, do come and look for me so that we can target them together. Yeah, so I have a photo in front of me and you can see it in the video as well. This patient came to me complaining of that she has quite a bit of a phobia of going to the dentist, so she hasn't gone for a very, very long time. And as a result, certain parts of her teeth have become not so healthy, not only the teeth, but also the gums themselves. So usually I would love to show you what happens at the end, like what happened after we completed all of her treatment. But life is not so much about the destination, it's also very much about the journey. So let me take you there. Okay, so in the photo in front, you can see, okay, back to the photo. We can see around the top teeth. So you're looking at a photo where imagine that this person is standing in front of you. So left is opposite from right, and that's how I would be speaking. So on the left side here, you can see this is where you can see the most amount of buildup over here. You also see quite a lot of buildup over here and over here. So, and also this part here. So this patient wasn't aware and just thought that her teeth were becoming discolored. But what was actually going on is that there's quite a lot of bacteria that is gathering around her gums. At the bottom, you can see that the bacteria is made up of soft bacteria and it's also made of this more yellowish, grayish color kind of bacteria. Soft bacteria can be easily brushed off with a toothbrush, and that's what we aim to remove off every night when you before you go to sleep. But if the bacteria has been there for too long, it means that the calcium and the minerals in your saliva have gone inside this sticky plaque and they have hardened it. A little bit like when you go to a cave and then you can see lots of limestone on the wall. It's a very, very similar kind of mineral makeup. It's just that the one in your mouth is embedded with bacteria. So the body doesn't like the bacteria and it keeps trying to move further and further away from the bacteria, which is why you can see this gum has been pushed down quite a lot compared to the one next door. So this part over here. And actually during the healing, after we remove the bacteria, this left side gum, I will draw it again. This left side in the one that I'm circling in red, the gum actually move back to its normal height. So let me remove all of this. After the cleaning again, the gum moved back to a nice position around here. Of course, this doesn't happen in all the cases, and if the bone underneath starts to get affected by the bacteria as well, you might be left with a gum that is quite receded and doesn't come back naturally by itself. In this case, then what you will need to do is probably some gum surgery or gum grafting, which our specialist does. And they will take gum from another part of the mouth and then put it there. So after the cleaning, she felt much better. Her gums didn't bleed so easily when you brushed it. And she didn't feel like her gums were so sore, and it also really improved. I think she told me it really improved how she felt about herself, because she Okay, so after we did a round of cleaning, in the next 2 weeks, the gums really healed quite nicely, and all these areas where the black parts went away, and the gum was able to heal nicely. The redness went away, and she also mentioned that there was not only less bleeding, the gums were less puffy, it felt a bit tighter and stronger, and also she had much less bad breath. So that was pretty important. Gum health is really, really important because it makes the foundation of the teeth, and without a strong foundation, the teeth can weaken and they can eventually become shaky and then drop out, which is not so nice because then you have gaps in between. It's also good to have healthy gums because it makes your brushing a lot more comfortable. You won't feel like every time you spit out there's blood everywhere. And oftentimes gum issues don't have any symptoms until it's really, really late. For example, if you feel like food keeps getting stuck in between the teeth, it's better to get it checked to see if is it a filling that needs to be changed, because sometimes if food keeps getting stuck at the same position, it can cause quite a lot of harm to one single tooth, and then the tooth can become shaky. It can, even the nerves inside the tooth can also die, and then you might end up losing the tooth. Okay, so enough about the pink stuff, which is the gums. I'll move on to the teeth as well. For her teeth, you can see that the teeth look quite short and quite squarish. So over here, they tend to have a squarish feature. And sometimes what we can do is to do a gum lift. So we increase the height of the gums here. Okay, so enough about the gum stuff. We will move to the teeth now. As you can see, the teeth look quite squarish and look quite short. Sometimes it could be because the gum is very, very puffy, and that causes the tooth to have this stunted kind of squarish appearance. So there could be two factors contributing to the short lookingness of the tooth. One is that the gum is too far down here, or the tooth itself is too short. So let's say if the tooth is of the correct height, what we could consider doing is to lift the gums up like this. So we can do a gum lift using laser or traditional ways of surgery. But with the proper measurements, the gum healing goes really, really well, and your teeth will have an instant lengthening effect. Of course, to make sure that you can do this, we need to check certain things in the clinic, so don't do this by yourself. And maybe the third and final thing that is very obviously staring at you is that there is these black spaces in between the teeth. So here and here. What happened to this patient is that she was missing an incisor. So a baby tooth was probably here, and the baby tooth didn't have an adult tooth growing underneath it. Then as a result, the three front teeth, so this guy, this one, and this one, are too small to occupy the space that is here to here. And therefore you're left with little gaps like this and this. How we target these spaces so that it doesn't look like there's a gap there is, one, we can try to do some fillings so that we close up the gaps. Fillings we use composite resin materials, which is basically like a plastic tooth colored material, and we reshape the tooth such that the tooth looks a little bit wider. So here and here, and then also for this one, maybe we make this guy a bit wider. So of course we try to even out the spaces so that you don't have just one tooth that looks extra huge. For example, if we were to only build up a filling, for example, if we were only to build up a filling on one side here, yes, you might only do a filling on one side, but then this tooth is going to look very, very huge and it will look like a square, which is not very, which can look a little bit fake. Yeah. So yeah. So while we redo this, redo this segment. Okay, so we can do fillings on each of the sides of the teeth, and we would try not to just do a filling on one tooth to close up the gap here, because then this front tooth will look very, very, very big, and which is not only it doesn't look very natural because it doesn't have the shape of all the proportions of a real tooth. And also at the bottom here, we're going to trap a lot more food and plaque, which is quite hard to clean over there. Yeah. The other way that we can go around this without fillings that might have quite a nice appearance is that we redistribute the space between the teeth here and do some alignment treatment. For this patient, if we were to move some of the teeth so that we can expand her jaw, so at the sides here, these teeth are curved in quite a lot. So if we can expand the jaw and try to get even more space at the bottom here, then we might be able to fit a tooth in the middle over here. And how we would do that is that we would move this tooth into this space here. Okay, maybe the third and most ideal way, so the most ideal way to close the gap would probably be to do some level of braces or Invisalign, which is an alignment treatment. And how we would do this is we need to calculate how much space do we have here. So in this segment here and here, and see if we can expand her jaw such that we fill up, we make the jaw less narrow here and here. Okay, redo. Okay, so the last and maybe the most ideal way that we can improve, that we can do something about the space in between the lower front teeth is to incorporate alignment as well. Usually for aesthetic cases, we try to look at the whole picture of the mouth and see if there are any other areas that we could improve on that could also enhance our treatment plan or our main complaint. And one of the things that I did notice about this patient's smile is that her smile is quite narrow. So you can see the teeth at the side here and here, and the teeth are tilting in towards the middle of the mouth. So when that happens, we know that her palate is quite tight, and when she smiles, there will be lots of space at the sides here. So it looks like your smile is not as smiley as it can be, if that makes sense. And how we do that is that we will use Invisalign or braces and try to expand her arch so that the teeth go out this way, or they're tilted out in that way. And then when that happens, the lower teeth can also go out a little bit more. These ones here, just maybe pushing them out about 1 to 1.5 mm each. And when that happens, the lower jaw here is also a little bit wider. And then we can have more space. Maybe move this tooth to the right here so that we close up this gap. And hopefully that there is more space to put in another tooth over here. Yeah. I did discuss this with the patient, but this wasn't a priority for her. Like the lower space wasn't a priority for her. So we put it, at the bottom of our priority list. But in the event that she wants to work on it, at least she knows what her commitments are, what the time frame is looking like, what the budget is like, and that's always a good thing to know at the beginning of your dental journey. Because if you have a goal in mind and where you want to go, it's much easier to for us to come up with a sequence of steps and how to go there. But if we don't know where to go, we don't know what our end goal is, then we will constantly be wandering around and we'll all be very, very lost. So yeah, as you can see, this kind of discussion of teeth and of what we can do to make your smile both healthier and prettier, that is not as stressful as it should be. So as you can see, a discussion centered around both health and making your teeth look prettier isn't all that stressful. Okay, so going through this discussion with the patient about health and aesthetics, it's not that by just achieving health that we won't also achieve aesthetics. And also when we achieve aesthetics, we also need to make sure that your teeth are healthy. So often it's a hand-in-hand process whereby we can just show you what steps need to be done to achieve your goal. If it's something that you are willing to do, then great. If it's not something that you are willing to commit to, or it's too expensive, or it's requiring too much time, then we can always find a solution that works for you. And then if we've exhausted all our options, then at least you know what you need to achieve in the future. And maybe if you change, if you feel ready at any point in time, then yeah, at least you know what you are prepared for. So yeah, I'm very excited to meet anyone who wants to get started on your dental journey. So look for me at Dental Designs Clinic.